So hello and welcome. We'd like to thank you for joining us for our first live past webinar. And I have to say we are very impressed by the number of past members that registered for today's webinar because we had over 200 people registered. So thank you, it's very exciting. My name is Karen Ogle and I'm the past membership team lead supervisor at Zengar. I'm joined by my colleague, Mark Nechaljan, as well as our education director, Dr. Lise DeLong, and our assistant director of education, Mark DeLong. So for over the past 4 to 5 months, we've been contacting a number of our clients and we've been asking them what topics would be of interest to them should we start a monthly live webinar. And based on the responses that we received, we chose today's first topic, which is training versus treatment. So after the presentation, we'll open the floor for a question and answer segment. And for the remainder of the hour, we'll be taking your questions. So without further ado, I will now pass you to Dr. Lise DeLong and Mark DeLong.
Thank you, Karen. Thanks
Hello,
for that
everybody.
introduction. I, of course, am Lise DeLong. This is Mark DeLong. You've probably heard our voices on the basic course or the advanced course, depending on what you've taken, or perhaps one of the webinars. So we're extremely excited to be here and be part of the PASS Q&A, and we are backed by our entire education team as we present this information to you. So we're very excited. We really appreciate you for taking the time out of your day and or evening, depending on where you're at, to join us and learn more about training versus treatment. I, for one, am super excited to introduce you to what might possibly be a perspective change as we look into a little bit deeper of the topic of dynamical NeurOptimal. It is enough different that I think that sometimes when we talk about training versus treatment, we start to go down the avenue of our language only. And I think this is going to help us kind of hone in our different educational backgrounds, our different belief systems, our different knowledge, as long as we all keep kind of an open mind to what dynamical systems are. And hopefully Mark and I are going to be able to help you through that process today in a little bit more in-depth way. So here we go. We're pretty excited to have you. And again, welcome. Okay, I'd like to start by saying when the brain understands the why of what we do, then we tend to find it a little easier to remember and actually use it, embrace it, and have that be part of your practice as you go to your office for the day. So instead of starting with training versus treatment, we want to start our story with synchronization through chaos and why that really dictates our ability to use training versus treatment. So let's talk just a tiniest bit about what synchronization through chaos is. And I know for some of you, this is kind of a reminder because you've just taken courses recently. For others of you, this might be brand new or just a reminder of what you took a long time ago. So synchronization through chaos is what happens when our chaotic electrical activity in the brain is recognized by the NeurOptimal software program. And if you'll recall, chaotic is really more about non-repeating electrical activity in the brain versus random, which at some point will repeat a pattern. So this chaotic electrical activity has to be controlled in some way. And we're going to get into that as we talk more about synchronization through chaos. As the brain and NeurOptimal start to synchronize together, call that communicating within the same language. So that communication system or language of the central nervous system is all about, one, noticing differences, and two, moving away from discomfort. This is the dance that our co-founder Valdine Brown talks about when we talk about the brain and the software doing this exchange of information. It's kind of a call and response with this synchronization that happens to occur. So why is this so important? Because in this meeting during our session, It's where the start of the training happens, or the dance of that synchronization through chaos actually occurs with NeurOptimal. This also means that NeurOptimal is complete unto itself, and there is no need to add any other products or protocols, because by adding anything more to the process, we may inhibit that dance of synchronization to occur.
So what happens if we decide to add or change any of these variables within the session? What happens if we start thinking NeurOptimal is good, but how can I make it better? Maybe how much better could it be if I added EMDR, EFT, binaural beats, you name it, you see it all out there. Won't that make it even better? And it's important to understand that our chaotic, dynamical nervous system really can be controlled by 4 different control procedures. We covered this in the course, but we thought it very important to look at it in this light when we're talking training versus treatment, because we as a dynamical system can be controlled by 4 different control procedures. And synchronization through chaos, as Lisa referred to earlier, is one of those, and the control procedure we use. But introducing any of these other 3 control procedures will not only conflict with the dance that Lisa talked about between NeurOptimal and the client, but it's also giving conflicting information that ultimately turns our client relationship into treatment versus training. We're pushing them some way with something. And when we are prescribing what we feel is best for the client, instead of allowing the training to function as it's designed, we're turning it into a treatment process. So just real quick, we thought we want to touch on these other 3 control procedures. So as you in your practice and you in your life can identify them and just take a step back and think, am I turning it into a treatment process? Is this conflicting with the NeurOptimal system? Extrinsic constraints are one that we hear all about, and you hear it all the time in the past forum on Facebook. But basically, it's introducing anything that will inhibit the full potential of the process. It can be, medications, vitamins, family dynamics, noises, lights.
Sometimes even a bird outside the
a
window.
bird outside the window that keeps you awake at night, that's impacting your ability to sleep. I myself fall back on the family dynamic one a lot from all of our clinics, and watching one person of the family progress while the others don't, and the dynamics that are basically holding the one who's our client, holding them back from reaching their full potential. We could go on for a lot longer on any of these topics, but let me move then to chaotic perturbation, the second control procedure for a dynamic system. This is in effect changing one thing, seeing what happens, and then changing something else and seeing what happens, and changing something else and seeing what happens. This is by definition what our linear neurofeedback systems are doing. You're going in, they're deciding to push and pull in a very treatment-based way, push and pull different frequencies, see what happened. Oh, that happened. Now I'm going to jump down to this different set of frequencies, see what happens, push a little more, pull a little more. In the courses, I refer to this as herding cats. Herding cats through a doorway, you can get there by jumping up and down, whistling, going back and forth, clapping your hands. It's not very efficient, but you can get that job done. In any of these things, you can control a dynamic system through any of these 4 procedures. It's just which is the most efficient for what we're trying to get done. The entrain and migrate, we see these systems out there everywhere. They're basically introducing a dominant something, a dominant frequency,
Or vibration.
hoping that we will entrain to that, migrate to that, learn from it, and stay there. There's a lot of different places to fail in that process. And typically, even when it's done, people will tend to migrate back. They haven't really learned how to be there. These are the systems you see advertisers say, we're going to address focus. because they've picked out a very select band of frequencies that they're going to just kind of blast into us, hoping we'll entrain to it, hoping that we'll migrate to it, hoping we'll learn from it, hoping we'll stay there. You can find those same things for focus or whatever.
And a
Lots of
big
systems
problem
out there.
with that entrain and migrate, excuse me for interrupting, is that it works while you're using them. You cannot sustain that though. At some point in time, your brain will go ahead and either migrate to something else or learn from one of these other control procedures to do something different.
And because it is a control procedure, we know we will entrain to it.
Absolutely.
It's just how efficient and how long-term is it. And then there's, of course, the synchronization through chaos, the one we're using, mimicking the communication of the CNS, creating that unique dance between the two, and actually learning from it in the way that the central nervous system has learned forever. And so the CNS just does two things. It's looking for these differences in our environment, and then it's moving away from discomfort. Okay? It's noticing differences, determining that this is a difference I want to keep in my life or not, moving away from the discomfort that is noticed in those differences. And these skills have been occurring in our central nervous system on an unconscious, continually communicating basis since birth. So all we're doing is we're tapping into that innate ability, giving it the information it needs, and moving away from discomfort.
So we want to talk a moment about how does the central nervous system do this? There's a term called process variability that controls the noticing of differences or the moving away from discomfort, meaning that we are infinitely cycling and self-regulating. That allows us to consistently look forward, backwards, and in the moment. This is probably a little on the silly side, but it kind of reminds me of one of those iRobot Rumbas, those little small vacuum cleaners that go around your home. They'll continually move until they sense something is in their way, and then they back out, they move around, and they go into a different direction. Of course, our central nervous systems are far more sophisticated than that, but at the same time, it's that same kind of feeling. We are always looking out internally and looking out externally for information that will help guide us on our path. And this is like what Carl Pridham had written in his books on language, the communication system that we use innately in our own bodies. And so to experience the differences or the changes that are kind of built in, and that cycling and that self-regulating of the central nervous system, that is the unconscious communication system that we have, internally. So these changes or differences can be both internal and external. So when we look at things unconsciously, we're noticing that our body temperature maybe you've got a temperature and it's getting super hot. Well, the CNS will immediately notice that. When it notices that, it sends a message to cool it off by sweating. We have different systems that are just set up to listen to the CNS internally. If you want to, kind of think about all of you as you're sitting there, most of us don't notice when we're no longer very comfortable in our position that we're in. We typically, unconsciously, will just change the position just because we're getting closer to that feeling of discomfort, and the CNS moves us away from it by, alerting our system to just move away and switch and go into a different position. So the CNS notices this also externally, and it will pay attention to the differences. Even when we're walking and we're talking to somebody else and we're not really noticing where we're at, we can switch from a sandy surface to rocks or slippery surface, and our footing will automatically change, or just kind of unconsciously, we start to change our gait so that we have better position as we're walking on sand that's moving. And so we accommodate our external environment as well. So the CNS is always looking for these little bitty subtle changes and then responds to those changes in whatever way makes sense in that moment. Or maybe they don't, it doesn't respond, it doesn't change, it doesn't do anything. Now that we have that little bit of a background of synchronization through chaos and what the CNS actually is doing, we want to define a little bit more what a training program is and why we call NeurOptimal a training program. So, of course, I went to Wikipedia. So training is teaching or developing in oneself or others a skill, knowledge, or fitness that relates to a specific useful competency. Training has specific goals of improving one's capability, capacity, productivity, and performance. I think all of us can relate to that definition when it comes to NeurOptimal. NeurOptimal is actually retraining or helping train the body's natural response, its innate ability to communicate with itself. With NeurOptimal, the process, the changes are referred to, or the way we refer to those changes is diffs, duration, intensity, frequency, and shift. And that's all within that electrical signal. In the NeurOptimal process, the more the central nervous system pays attention to those diffs, the more the synchronization is going to take place. So those slight interruptions in the music is just a real gentle reminder to the CNS to pay attention to the differences.
As a reminder, this is happening in the software product too. In this whole synchronization issue, we're talking about, Lisa's talking about the diffs in regards to us personally, but what the software is doing at this point, it's actually looking at the flow of electrical activity and looking at that in terms of duration, intensity, frequency, and shift, following the movement of that at the same time. That's really an integral part of this synchronization between the two.
And doing it 256 times per second.
Yes.
So at that moment, then, the individual's central nervous system decides, will they change? Possibly. Will they not change? Possibly. Just like the little iRobot, do they really sense that there is something in front of them and they have to move? Or are they going to stay in that path and run into something? That is just, part of what the central nervous system decides to do at, as it's doing that process variability and going back and cycling and recycling and so forth. Just as a reminder on this point, though, our central nervous system, our brain, our body is always constantly changing. I remember Val's voice speaking to me right now, saying that it takes a lot of energy to not change. This is something that you have to almost consciously do, is not change. I mean, our bodies just so naturally are changing all the time.
Thankfully.
Yes.
So what this comes down to is, no matter the diagnosis, no matter the medication, no matter the age, no matter the gender, no matter the fill in the blank, we offer the training in the same way, because the training itself will synchronize with that person to whatever their issues are. So, Val's quote of "Nothing we see or hear will indicate a justification for changing the parameters of a training session" really rings true once we understand what changing any of that does to the entire process. So when we talk about treatment, we generally need to develop a plan to, quote, fix it, right? A detailed plan with information about the patient's disease, the goal, the treatment options for the disease, possible side effects, expected length of treatment, progress and outcomes, documenting progress towards goals. That towards goals part is really key. It's considered to be one of the most important aspects of a mental health treatment plan. Progress and outcomes of the work are typically documented under each goal. Dr. Sue Brown, co-founder, her quote basically is, "We're not here to fix someone, we're here to offer this system. What they do and their response is up to them."
Yeah, this reminds me real quick that with chaotic information that is obviously going on in our brain at all times, we are not able to predict what will happen. There will not be a pattern of this is going to happen again. So we cannot predict it, which is exactly what happens in this treatment plan. And we also can't judge it because we don't know what path they need to take to get wherever it is that they're going.
Yeah. We need to use a different vocabulary, right? When we believe we are treating a client versus training a client. Things that we hear in treatment are this list here. I'm going to help fix this. I'm going to cure you. You are the patient. We're attacking this diagnosis, this group of symptoms, issues. Clinic and clinical are words that pop up a lot. Analysis of statistics, which I'm big on anyway, but it would take it to a treatment plan. Therapy, looking at anatomical changes, protocols, prescriptive languages, and basically let's reduce or let's increase fill in the blank from session time to session date to vitamins to everything else. So when we use this treatment vocabulary, it tends to create a feeling that we as trainers can do more with the NeurOptimal program by changing parameters than we can or should be doing in a 33-minute session. It also creates a hierarchy that in a training process is not necessary. There's a strong chance a dependency is created, one that suggests that the client can't recognize that they feel better without the verification of the trainer or the verification of the system. What does the system say I'm suffering with today? Does the system say I'm better or I'm worse? We want to keep from getting into that position where they ever even expect that that's a possibility. So we can innocently turn our training into treatment using statements like these. Let's try doing shorter sessions or longer sessions. Let's skip a session. Let's change your session to morning versus evening. Reduce caffeine, reduce wine.
Increase wine.
Increase wine. Increase wine. Let's try that one. Here's one we hear a lot. Because you have trauma, let's add blank. And there's many different ways that people fill in that blank. Creating a protocol to address that particular issue. And in the last statement, because you have trauma, let's add blank. We really could say because you have blank, let's add blank. And any number of words can fit in there. So changing the timing to change the outcome, adding to this process we talked about earlier to create something even better. Many times can be an extrinsic constraint, but absolutely turns it into a treatment versus a training. And the last one we hear loads to believing that because you have a specific diagnosis that they need to be treated differently. And we really addressed that with Val's quote earlier. Nothing we know, understanding the way this process works would lead us to change anything about offering this process on the 33-minute regular session.
Yeah, this is all real prescriptive language, and nothing that we change is going to make a difference. So what can we use in place of these? It's one thing for us to give you this information, but what we really want to leave you with is what now? What can you do? How can you change your language to be able to accommodate this process of dynamical neurofeedback? So how we can change treatment language would be to listen to the words they use when they come into the office, but deliberately change those words to non-prescriptive, non-directive, non-medical, without adding any kind of a hierarchy to your protocols, your office protocols. And I don't mean that by changing the protocol that you're using with them, but your routine within your office. So one way you can do that is when you ask the client, what brings you in today? And they probably will respond with, I have migraines, or I have sleep apnea, or I have ADHD or autism, or any number or anxiety of things. Try changing their dialogue as you respond to them so that they start to learn the training dialogue. they probably are only repeating their dialogue in that way because someone else, and possibly a medical person, mental health person, has given them these labels. And so talk to them in a way that describes how they feel versus what their label is. They can't focus, or they can't sleep, or they have headaches, or they get a little stressed out when they're with a large group of people, or whatever they're trying to tell you, change it into the feeling type words, because then you can ask some outcome questions that will really help empower them and probably reduce some expectations. Like, how would you feel if this were changed? How will you know if this is working? How will you feel any different? What difference will that make in your life? Try to create an atmosphere that you are empowering them to sense or recognize their internal feelings. And actually that they're noticing these very subtle different shifts. Help monitor their frustration levels, or their happy feelings, or their tiredness, or their pain, and use the diffs: duration, intensity, frequency, and shift. Because many times there's going to be a lot of little bitty subtle shifts that occur, and they'll probably occur pretty quick, but they have to add up to be one larger change before they start to recognize them, and help them understand that. Explore what will have to happen for them to know the training was worth them coming into your office that day. What will that change look like to them, and how will that change their lives ultimately? So we'll talk a little bit more about setting expectations and releasing expectations, in our next past Q&A, which we certainly hope all of you will attend. But this is just kind of a beginning, just to start thinking about that. Your first time with your new clients, or with your clients, is one of the most important times. They say you can't always take away that first impression. You really seriously can't. If you are talking in any prescriptive language, that language will last a very long time in their journey. So the idea of designing a process of empowerment, allowing them to create their own schedule based on, your schedule, but also how they feel. Encourage them to keep a written or audio journal. Use those tracking tools that we have created, and create more of that detective persona with them, rather than that hierarchy with them. The thing is, people rarely come into our office talking about, the amplitude of my electrical signal is, and they're really not expecting you to talk that way either, unless they've been taught about this in a linear program. And then you have the responsibility of releasing those expectations and teaching them more about what a dynamical neurofeedback system is like. We search to find meaning in all the information that we gain. NeurOptimal is giving us information. And our perception of that meaning changes with every different individual and with every different session that we do. And this is really important. When we do our first session, we will not repeat that first session again. Remember, this is chaotic. We will never have that first session again. So when someone comes into your office and they say, oh my gosh, I slept so good tonight, this was the most perfect session. And then they came in a second time and they didn't have the exact same performance level that they had the first time. Well, that was what their CNS did the first time, and this is what their CNS is doing the second time. So it is really, every session will be a new and different session. And we can only look forward to what the next session is going to be after having an exciting last session.
That just drives home the fact that not only is every individual different from every other individual, but each individual is different in every moment.
Absolutely.
You didn't present this exactly the same way on your first session that you're going to do on your second session and your third session. So it never will be exactly the same session. It will be the same type of session, but it depends on that synchronization and where you are and the information you receive from the system.
That is exactly true. I want to read a quote that Val had once that I find to be important right now. But information is embedded in difference that has been perceived. Learning is an information-rich feedback process that opens up degrees of freedom, grounded in perception, memory, and oriented towards increasing resilience and flexibility. Learning adaptively extends inherent capabilities based on perceived differences in our environment. So as trainers, we want to empower our clients to learn more about NeurOptimal so they understand what personal transformation happens or how it happens, when our CNS remembers how to do one of two things: notice the differences and move away from discomfort. When the brain or the CNS is able to do that, that's when we start seeing this flexibility and resilience start to play out in our world and lives. So what we're looking for is training that innate, natural way of communication through differences. So we hope this short presentation was helpful and that you will now understand the why we say NeurOptimal is training, not treatment. So Karen.
Thank you, Lise and Mark. That was very informative. Thank you. So now we would like to open the floor for your questions. So we invite you to type in your questions in the chat box below. Just make sure that they're being sent to Karen Ogle. I will read them out loud, and then we'll do our best to answer as many questions as we can in the remaining time. So one question, and I get this quite often, so we're going to start with this one while you have a chance to type in your questions. But isn't training versus treatment more about FDA and our legal ability to use terms like disorder or symptoms?
And do that one, or you want me to?
Go right ahead.
I don't want to hog the questions though.
It's okay.
So the FDA came about far later than any of the process that Val and Sue, our co-founders, created. We have always been training, not treatment. This is not something that, oh, we want to register with the FDA, we want to bring them in, so therefore we have to change our wording. That has never been the case. We are always training, not treatment. I don't know what to say about that one.
Yep. Perfect. Another question that came in: won't a client think we are not a serious process if we can't or don't talk about their disorder? Won't they think we don't care about them if we don't acknowledge their problems?
Oh, that's a good question too. Actually, I don't think that's the case. I think that as you start to explain what a training program is and how NeurOptimal is so very different, we talk about it being so simplistic and that it is not it's not a serious thing because it's so simple. To create this was an incredibly difficult thing to do. I mean, it was luckily given to us as simplicity. More than that, I think that, as caring, empathetic, maybe sympathetic people that we are, we will always address them with their concerns and their problems. We just want to change that language into language that makes more sense for this paradigm.
Yeah, and I think that a real important point is that no clients ever presented to us as carrying a single diagnosis.
Oh, no, actually, yeah.
And they have a primary diagnosis that they've come in to say, I need help with this.
Mm-hmm.
But very rarely, I can't think of any time that there was just a singular. If they come in and they say, I'm suffering with anxiety. I mean, we can be empathetic to that and say, that's got to be bad and
that hurts.
That's going to be a remark. But if somebody's suffering with extreme anxiety to the point that they're out looking for help and they've been to the doctors and maybe taking drugs and maybe they're throwing everything they can at this,
yeah,
I can guarantee you they have a sleep disorder. That you can't be sleeping well at night if you're that anxious. And if you're that anxious and you have an extreme sleep disorder, you have executive function skill issues. You can't focus at work, you can't do mental math, you're just exhausted. And so a great part about this system, and this, conversations like this with your clients opens up this discussion, is that, by us addressing all of the frequencies, practically all of the frequencies all of the time, we're addressing this full person that's come into you. We're not jumping around chaotic perturbation. Remember, we're not addressing the anxiety, and then next time we're addressing the sleep, and the next time we're addressing this. It gives us the ability to explain the dramatic difference between dynamically addressing the entire system rather than linearly addressing one issue.
Yeah, very specific things.
We do discuss those issues with them,
Mhm.
but it opens up a much bigger discussion too.
Super. Another question here. What if we are a mental health therapist or a physician and our clients are patients and they are there to use us as a medical professional? How should we respond?
Another good question. I love that one too. Your educational background, your experiences are all part of what you bring to the table. And we would never suggest that you give up your medical degree or that you give up your mental health process. It's nothing like that. We appreciate the knowledge that you have. We appreciate tremendously, everything you bring to the table. Because of that, though, it puts you in a little bit more of a difficult spot because you have to be very consciously separating the two processes. You have one process that you have to wear this hat with, and you have another process that you have to wear a different hat with. And part of the big reason that you want to wear this other hat is because you do not want to turn it into a treatment program. Once you do, as Mark had said in, I don't know, the 4th or 5th slide, that once you start adding other things to it, then you change the ability for NeurOptimal to do the very most that it can possibly do. It's not saying that it can't be done. It's saying that we don't know the outcome. We don't have any idea. You might get some very interesting results. And I would just, when you understand why we say it is training, not treatment, we would like to think that you'll create your program around that. So that if you're doing your treatment, it's in one place, it's doing something, and you'll do this other in a totally different place.
And you got another medical practice, and the idea of using all those medical terms in your medical practice is proper.
Mm-hmm.
It's just this overlap of I see this diagnosis, this deficit, and I think you should go onto that treadmill and use that treadmill as you see fit, and we'll monitor the shifts. So we're not saying you can't be a medical professional.
Not at all.
It's just that understanding the training aspect of what this system has to offer and referring to that in the right context is fine
And important.
and very important. Absolutely.
Okay, perfect. I have a question here. How is NeurOptimal different from TMS?
Basically, that's what you're doing is you're putting a magnetic field into your head, right? And that is the definition of entrain and migrate. They've decided that they know better what's in your head than you know, and they've said you need more of something. They're bombarding you with a dominant frequency, a dominant magnetic resonance, hoping that you'll entrain to that, hoping that you'll migrate to that, hoping that you'll learn from that, and therefore stay there. It's very intrusive. We need to go back to the idea that, there is no norm. We don't all need so many microvolts on average of a certain frequency on the left hemisphere, take that wherever you want. So this is the technician or the doctor or the whatever saying, I'm just going to blast this frequency into you and let's see what happens. Sort of on a chaotic perturbation mix with entrain and migrate. Let's try this and see what happens. Let's try that and see what happens. The difference then to NeurOptimal, of course, completely non-invasive to the point that we won't even put a minute electrical current back through the sensor to test hookups. Okay, so I mean, it is completely benign in that part. And so all we're doing is giving you information in an audio way for you to know, hey, is this information I want to respond to, or can I use this information to move away from discomfort, as we said earlier, in the innate internal ability of our central nervous system to do that. We're not forcing anything versus they're forcing everything.
Okay, perfect. Next question. What if a person doesn't experience any positive changes? Since we are not saying things like having X number of sessions is when you may see some changes, how can they be encouraged to continue with NeurOptimal if this is the case?
I always love that one, because what they're noticing is there is changing. Something is changing, and they are designating it as not positive. So I think that's always a really interesting thing. If they are changing, they are changing, and their central nervous system is responding to the process. So then what is really important is for us as a trainer to really document and notice those little bitty subtle changes and look to see how those are affecting their lives. It's really, to me, always interesting that it's either good or it's bad, right or wrong. It isn't about that. It is moving through a little journey that they're taking that is going to go in lots and lots and lots of different directions. The problem is that when we witness or feel or sense what we would call a bad thing, we don't always notice all the little bitty minute good things. Like if we're keeping track of the fact that they're having problems falling asleep and it's taking them an hour and a half to fall asleep, they just lay there thinking, well, by really, really, really closely watching that and writing down how long it actually is taking, little by little, you'll notice minutes are taking off of that. And now you're falling asleep within, 30 minutes. Well, that's also a change. It isn't the change they want yet, but it is a change. And so it's really keeping track of all of those really small, minute changes. It's really a challenge for us as trainers, but a really, really, really important one for us to maintain.
And to push on this fact of them perceiving something as, how do they put it, not positive.
Yeah.
as not positive / negative / whatever. Or is that now that we've had this deep session on how the central nervous system works and how it responds to differences and how it is designed to move away from discomfort, we know that internally we're not going to move in a direction that will harm us. We don't step in front of the bus. So movement is a really important thing to notice and to praise for a client. And we don't know and we know internally that they're moving away from discomfort, but they may need to move. This may be part of their path to move away from this discomfort. They may be noticing something that they didn't notice before, negating the 170,000 other things that could be going on. They're focusing on this, but this is more than likely part of their path. It's a positive in the way that, hey, we started neurofeedback and you started responding, and we know you're moving away from discomfort. So like Sue would say, keep on keeping on.
Okay, so we've got another question here. Does it make sense to speak about the central nervous system regulation and that process with clients? We find it helpful to share that it isn't treatment, but rather training for the central nervous system, and that the hope is the central nervous system observes itself and moves forward more regulation, aka away from discomfort. So I guess the question is, does it make sense to speak about central nervous system regulation and that process with the clients?
I'll start if you want.
Okay.
I think it makes sense, because I mean we've based this whole presentation on the central nervous system and how it works. I think that in their question, I heard that the hope is the central nervous system will notice and respond. It's more than a hope. It's going to notice and it's going to respond. That's its job. It's going to notice differences. It's going to respond.
And I think I would add to that, we do not need to talk a lot about the anatomical processes that are going on in the brain, in the central nervous system. We don't really have a camera looking inside of it. We do not know, we haven't done CAT scans, we haven't done SPECT scans, we haven't done, functional MRIs, we haven't done any of that. Nor does anyone do that I'm aware of on a regular basis. So I think anytime you are putting yourself out, talking about anatomical components, you run the risk of having to prove it. The central nervous system, we do know these are the two things that it does. And so I think as long as you're speaking about the CNS in the way that we spoke about it today, by all means, feel free and comfortable to do that. And it probably is very comfortable for an end user to understand that we understand what dynamical systems mean. The more you can educate your end user, the more comfortable they're going to be, and the more confident that you're going to be.
Perfect. Okay, another question here. As a client, I would be confused about the term synchronization. Are you saying my brain will become more synchronized with itself? If the synchronization is with NeurOptimal, why would I want that?
This is more in the line of during the session, and it's not that your brain is synchronizing with NeurOptimal. It's that NeurOptimal is synchronizing with your central nervous system to respond to its diffs, its movement in its electrical activity, and speaking to it in the same way that it's designed to listen, which is looking for differences. That's what the clicks in the music are. That's the difference in the environment. And so it's not that we've got some normal cortical pattern that we're trying to get you to synchronize with. You are you. We're just coming in there, and you can see it happen in the matrix mirror. You can see the software system basically come in, synchronize, and dance with your cortical activity. And then it just is providing the information. It's allowing you to be you.
And I would say if your brain were synchronizing to any other instrument system product, then you're getting into an entrain program.
Yeah.
We're not entraining a brain to do anything. We're training the brain to listen to itself again and notice information.
Perfect. So we only have time for one last question, and I wanted to ask this question because it's a question we get a lot in our head office, and that is, where can I find the verbiage to use on the website that complies with the FDA and Health Canada regulations? So if you're not aware, you can find those documents by going to our website, neuroptimal.com, going down to the footer, and then there's under the resources heading, you're going to find FDA guidelines and statements and Health Canada guidelines and statements. And if you click around in there, you'll find it very useful because you can select on a certain issue or subject, and then it will give you a suggested response or explanation that you can use with your client. And it also, you'll be able to see words and verbiage that you can use, words and verbiage to stay away from. So it's quite helpful. So that's on our website in the footer section.
Excellent.
So unfortunately, that is all the time that we have. Thank you so much, Lise and Mark. That was very helpful. I know I learned a number of things as well. We did record the webinar today, so we'll make sure that that's available on our Facebook support group for our past members. We will also have the option for you, if in different languages, you can have the subtitles added as well. So we thank you for taking the time to join us, and we invite you to our next live Q&A, which is scheduled for Thursday, April 20th at 3 p.m. The topic is going to be releasing expectations and tracking shifts. And you'll be receiving the link to register in the April past tips email. So if we did not answer your question today, please feel free to email directly our education team and they can answer your question. education@neuroptimal.com.
Excellent.
Thank you so much to everyone, and we hope to see you next month.
Thank you,
Excellent.
everyone.
Thanks.
Bye-bye.
Bye.